Hi, I'm Dr. Behnaz, pelvic floor specialist. Do you ever sit down and feel a sharp stab or deep ache right at the base of your spine? Maybe the pain builds the longer you sit or flares up every time you stand from a chair. Some describe it as a sitting on a knife, while others feel it as a constant pressure, burning, or bruised sensation right at the tailbone. I work every day with patients who struggle with pelvic pain and tailbone pain, also known as coccydynia, is one of the most frustrating. It can make normal things like working at a desk, driving, or even sitting with family at dinner feel unbearable. Tailbone pain can show up in different ways. Some patients feel sharp stabbing pain right when they sit, especially on hard surfaces. Others feel a heavy, dull ache that slowly builds. Some notice pain shooting upward into the lower back or into the pelvis. It can get worse when leaning back, climbing stairs, or sitting too long in one position. And sometimes, even the small act of shifting in your seat is enough to trigger pain. Why does this happen? The tailbone is more than a tiny bone. It's surrounded by muscles, ligaments, and nerves. After a fall, difficult childbirth, or even from repeated strain like cycling or prolonged sitting, the tailbone and surrounding tissues can become irritated. The pelvic floor muscles may tighten around it, pulling on the area and keeping the pain cycle going. Sometimes the joints around the tailbone stiffen, or scar tissue from injury or delivery adds more restriction. So, what helps? One of the first changes is how you sit. Cushions designed with a cutout at the back, often called tailbone cushions or U shaped cushions, take direct pressure off the tailbone. Donut cushions can help too, though some patients prefer the U-shaped design because it supports the thighs while leaving the tailbone free. Adjusting your posture by leaning forward slightly or shifting your weight to one side can reduce irritation. Many patients notice a big difference just by using the right cushion in the car or at their desk. Exercises and movement are another key part of recovery. Gentle stretches that open the hips and relax the pelvic floor can ease the pull on the tailbone. So, positions also like child's pose, happy baby, supported butterfly, or lying on your back and hugging the knees to your chest all encourage release. Breathing exercises that focus on softening the pelvic floor, letting the muscles drop with each exhale, can calm the constant guarding many people don't even realize they're holding. Manual therapy can also help when self care isn't enough. Skilled pelvic floor therapists can gently mobilize the tailbone, release tight ligaments, and ease scar tissue that's pulling on the tailbone. This hands on approach often brings relief to patients who felt stuck by years. Daily habits matter more than people think. Breaking up long sitting periods with standing breaks and alternating positions or using a sit to stand desk prevents constant pressure. For drivers, adjusting the seat angle or using a wedge cushion can make a huge difference. Mindfulness, yoga exercises, or even short relaxation breaks during the day can keep the whole system calmer. I worked with patients who dreaded car rides, couldn't sit through a workday, and avoided social activities because of tailbone pain. With the right cushion, posture changes, pelvic therapy, and lifestyle adjustments, they were able to sit comfortably again and return to normal life without fear of pain flaring up. So, if you're struggling with tailbone pain, know this: it's not something you have to live with forever. With the right strategies, from cushions to exercises to daily care, your pain can ease and sitting can become comfortable again. If this video gave you clarity and hope, please subscribe, like, and turn on the notification bell. I'll be sharing more step-by-step strategies to help you overcome pelvic pain and live with confidence again.